Okay, imagine for a moment this quiet, unseen architecture inside you. Not your thoughts, not your feelings, but the actual framework holding you up. The thing that lets you walk, dance, hug someone you love, our bones.
Right. Absolutely fundamental.
But what happens when that framework, which, let's be honest, we mostly take for granted, starts to quietly lose its strength without any pain, without any real warning?
Yeah, that's the crux of it.
So today we're doing a deep dive into osteoporosis. People often call it the silent thief, and for good reason.
It really is.
It's a condition where bones get, well, more porous, right?
Yeah.
Brittle,
Making them
super vulnerable.
Exactly. Fragile.
And the really scary part, the alarming thing, is that for so many people, the first sign isn't some quiet hint. It's a sudden, loud, shattering event.
Like a fracture.
Yeah, exactly. A broken hip, maybe, or you notice your posture changing, getting stooped, almost without realizing it.
Or that sharp, awful pain from a spinal compression fracture. That can come out of nowhere.
So our mission today in this deep dive is really to pull back the curtain on this. We want to dig into the hidden causes, figure out how to spot those quieter warnings before something major happens.
Before the crisis hits.
Right. And importantly, uncover some powerful natural ways you can strengthen your bones, reclaim that active life, especially, as we get into our golden years.
Absolutely. It's about empowerment.
Think of this as your guide, really, understanding not just what's happening, but what you can actually do about it, how you can shape your bone health.
It's a fascinating process when you look closely. If you could, zoom right into healthy bone, you'd see this dense, really intricate structure, almost like a perfect honeycomb. Tiny spaces, but strong.
Okay, I can picture that.
But with osteoporosis, those tiny spaces get bigger, the bone itself thins out. And that strong honeycomb, it becomes dangerously fragile, and that's why it's silent at first. There aren't nerve endings in the bone to scream, hey, I'm getting weaker.
Not until it actually breaks.
Exactly, only when it breaks.
Wow, that honeycomb analogy really hits home. So it's not just bones wearing out then. What are the real reasons this structure gets so weak, especially as we get older? What's at the root of it?
Well, the simple fact of aging is definitely a big part of it. As we get older, our bodies just naturally get less efficient at keeping up bone density. See, bone is living tissue. It's constantly remodeling, breaking down old bone, building new stuff.
Right, at that cycle.
But with age, that balance shifts. The breakdown often starts to outpace the building process.
And for women, there's something that really speeds that up, right? Hormones.
Oh, absolutely. That big drop in estrogen after menopause, that's a major accelerator for bone loss. Estrogen is crucial for keeping bones strong.
And for men. Does testosterone matter?
It does, yeah. Declining testosterone also leads to bone loss in men, but it's usually a slower, more gradual process compared to the post-menopausal drop in women.
Okay, so hormones are huge. What about what we eat? You hear so much about calcium.
Definitely. Calcium is like the main building block. Think of it as the bricks for your bone structure.
Right.
But here's the thing, it's not just about eating calcium. Your body has to be able to use it. And that's where vitamin D comes in. It's like the master key.
The key. How so?
Vitamin D unlocks calcium absorption in your gut. Without enough vitamin D, you could be eating loads of calcium, but it just, passes right through. Your body can't grab onto it.
Ah, I see. So they work together.
Totally. And we can't forget other important players like vitamin K2, magnesium. They help make sure the calcium goes where it's needed, into your bones, not, your arteries.
So it's like a whole team of nutrients working together, not just calcium on its own.
Exactly. A symphony, like you said earlier.
And what about how much we move or don't move? Does that really affect our bones? Are they listening?
They absolutely are listening. Bones are incredibly adaptive. They respond to stress, to the forces you put on them. So if you lead a very sedentary life, you're basically sending a message. Hey, body, strong bones aren't really required here.
Right. No demand.
Exactly. And that lack of physical activity, especially weight-bearing exercises, the kind where you're working against gravity, signals the body to actually reduce bone density. This is a big deal, especially for people over 60 who might naturally slow down a bit.
So it really is a use it or lose it situation for our skeleton.
Pretty much, yes.
Okay, beyond diet and movement, are there other things that might surprise us?
Oh, definitely. Certain medications can have a big impact. Long-term use of corticosteroids, for example, often used for things like asthma or arthritis, can interfere with bone building.
Okay, that's important to know.
And some medical conditions too. Rheumatoid arthritis itself, hyperthyroidism, even some gut disorders that affect nutrient absorption, they can all speed up bone loss.
So it's really worth talking to your doctor about this stuff.
Absolutely. Always have
Yeah.
that conversation. How might my meds or my health conditions be affecting my bones?
And it's not just prescriptions, is it? Our everyday habits, our lifestyle choices, they matter too. Like smoking, alcohol.
Precisely. Smoking is particularly bad. It reduces blood flow to the bones and messes with calcium absorption, so it's a real double whammy.
Wow.
And too much alcohol. Well, it directly harms the cells that build bone. Plus, pretty obviously, it increases your risk of falling. And falls are disastrous when bones are already fragile.
Makes sense.
No.
Okay, what about the thing many people worry about? Genetics. If it runs in the family, are you just doomed?
That's a common fear. And yes, having a family history, especially like a parent who had a hip fracture, definitely increases your risk. Your predisposition is higher.
Okay.
But it's not a guarantee. It's not destiny.
Yeah.
Think of it like this. Genetics might load the gun, but it's often lifestyle that pulls the trigger.
Oh, okay.
So knowing you have that genetic risk should actually make you more motivated to be proactive, not less. It just means every healthy choice you make counts even more.
That's a good way to look at it. So maybe as you're listening, just take a second to think. Am I getting enough calcium, enough vitamin D? Those supporting nutrients, it's not about being perfect, just, aware.
Exactly. Awareness is the first step.
Okay, so we've established it's the silent thief, no pain signals usually, but you said our bodies are amazing communicators. They do send out whispers, right?
Yeah,
Before the big shout of a fracture.
they do. The tricky part is these whispers are so often just brushed off as, oh, I'm just getting older.
Right, like what sort of whispers?
Well, one common one, often missed, is gradually losing height.
Losing height, really?
Yeah. If you find you need to adjust your car mirror more often or your trousers seem longer, losing an inch or more can actually signal tiny compression fractures in your spine. The vertebrae weaken and sort of compress.
Wow. And that affects more than just height, I guess.
Oh yeah, it impacts your posture, can even make breathing harder over time.
And speaking of posture, that sort of developing hump, the dowager's hump people talk about,
Yeah.
that stooped upper back.
That's a more visible sign, usually indicating more advanced osteoporosis. It's those weakened spinal bones again. And it's not just how it looks, it often leads to chronic back pain, balance problems. It can really affect your confidence.
Yeah, I can imagine.
And just persistent back pain itself. Especially a chronic ache or maybe a sudden sharp pain in your middle or lower back that doesn't have an obvious cause. If it gets worse when you stand or walk and feels better when you lie down, that can be a big red flag for one of those vertebral compression fractures. It's your spine basically saying, help.
And then the loudest shout, the undeniable one, breaking a bone from something minor.
Exactly. Those fragility fractures. Breaking a bone from falling from just standing height or sometimes even less.
Or just bending over or coughing hard.
Yes. Things that absolutely shouldn't break a bone. The hip, wrist, and spine are really common spots for these. And if that happens, it should never just be shrugged off as a clumsy fall. It needs investigation.
Okay. Any other subtle signs?
Here's one that might surprise you. Receding gums.
Gums. How are they related?
Well, your jawbone is bone too. And if it starts losing density, your gums can actually recede. Your dentist might be the first person to notice something's up.
Huh. Never would have connected those.
It's all connected. And some studies even suggest a link between weaker grip strength and lower bone density overall. Not a diagnostic tool on its own, but another potential clue the body might be giving.
Interesting. Now, you mentioned a traditional Vietnamese medicine perspective earlier. How does that view bone health?
It's a fascinating holistic view. In traditional Vietnamese medicine, bone health is seen as deeply connected to what's called kidney essence.
Kidney essence.
Yeah, it's considered the root of our vitality, our growth, our foundational energy. So things like chronic low back pain or just a general feeling of weakness in the joints might be seen as a sign that this kidney essence is deficient, which in turn contributes to bone fragility.
So it's looking at energy levels almost.
It's looking at the whole system, yeah. And the flow of key life force and blood. If there's stagnation, blockages, then the bones aren't getting the nourishment they need. It's a broader perspective than just mineral density.
That really adds another layer.
Yeah.
So maybe let's suggest a quick check-in for everyone listening. Right now, just take a moment. Stand tall. How does your back feel? Do you feel as upright as you maybe used to? It's just an observation, but maybe a useful one.
A great little exercise in self-awareness.
Okay, so we've unveiled the thief. We've learned to listen for the whispers. Now, let's shift the focus. Let's challenge that idea that bone loss is just this unavoidable slide into fragility.
Absolutely. That narrative isn't quite right. While some bone loss with age is normal, the severity can often be significantly lessened. And in many cases, bone density can actually be improved.
Really? You can improve it?
Yes. Remember, bone is living tissue. It's always remodeling. If you give it the right tools and signals consistently, it can respond positively. It's about holistic practices.
Okay, let's talk tools. Nourishment first. Calcium, obviously foundational. What's a good target for older adults?
Around 1,200 milligrams a day is a good goal. And yeah, dairy's a source, but let's think broader.
Like what?
Leafy greens are fantastic kale, collard greens. Interestingly, the calcium in these is often better absorbed than from spinach because spinach has oxalates that can interfere.
Good tip.
Fortified plant milks, almond, soy, oat. Sesame seeds are packed with calcium. Canned sardines and salmon with the bones, yes, you eat the soft bones.
Really? Yeah.
And tofu that's set with calcium. So much variety out there, it's about getting it from different places.
And calcium's best friend, vitamin D, the sunshine vitamin.
Absolutely critical. It's the key, remember. Lets your body actually absorb the calcium. Without enough D, the calcium doesn't get in.
What's a good target for vitamin D?
Aim for around 600 to 800 international units, or IUs, daily. But honestly, it's best to get your levels checked by a doctor. Many people, especially if they don't get much sun or live in northern climates, might need quite a bit more, often through supplements.
And sun exposure helps.
Yeah, about 10-15 minutes a day on bare skin without sunscreen can make a difference. And fatty fish, like salmon, mackerel, plus fortified foods.
And it's not just calcium and D, right? You mentioned others.
Right, the whole orchestra. Magnesium, think nuts, seeds, whole grains. Vitamin K, especially K2 leafy greens again, helps get calcium into bones. And don't forget protein. Lean meats, beans, lentils, nuts protein forms the actual collagen structure, the framework of the bone.
So a varied, nutrient-packed diet is key.
Absolutely. It's your bone's best defense on the nutrition front.
Okay, what about movement? You said it's medicine for the bones.
It really is. Weight-bearing exercise, anything where your bones and muscles work against gravity sends that powerful signal. Build. Strengthen.
So like walking.
Brisk walking is great. Aim for maybe 30 minutes most days if you can. Dancing is fantastic too.
Fun and good for you.
Totally. Joyful movement. And things like Tai Chi and Qigong, these ancient practices are amazing, not just for bone density, but they dramatically improve balance and flexibility.
Which helps prevent falls, right?
Hugely important. Reducing fall risk is critical. And don't knock light strength training. Using light weights, resistance bands, even just your own body weight, think chair squats, wall push-ups. Building muscle actually helps support and pull on the bones, stimulating them.
Good point. Muscle and bone health are linked.
Very much so. But a really crucial point here. Always talk to your doctor before starting a new exercise routine, especially if you already have osteoporosis, other health conditions, or a history of fractures. Safety first.
Definitely. Good advice. So, diet, exercise. What about general lifestyle harmony?
It all plays a part. We mentioned quitting smoking and limiting alcohol. The benefits for bones are significant.
And stress. Does that play a role?
It can, indirectly. Chronic stress can mess with your hormone balance, which can impact bone density over time. So finding ways to manage stress, meditation, deep breathing, even just spending time in nature can be surprisingly beneficial for your whole system, including bones.
Makes sense. And for people who already have fragile bones, preventing falls is just non-negotiable, isn't it?
Absolutely critical. Simple things at home. Make sure lighting is good. Get rid of tripping hazards like loose rugs or clutter. Wear supportive shoes, maybe consider grab bars in the bathroom. These practical steps can prevent a life-altering fracture.
Practical, but potentially life-saving.
Exactly. And from that traditional Vietnamese perspective, again, sometimes herbal allies are used. Things like Eucommia barca trunk, traditionally used to strengthen bones and tendons.
Okay.
Or Cuscuta seed thought Tai Tu, believed to nourish that kidney essence we talked about, supporting overall vitality and bone health. But again, these should always be discussed with a qualified practitioner as part of a personalized plan.
Understood. It's part of a bigger picture, so maybe a little challenge for everyone listening this week. What's one new calcium-rich green you could try adding to a meal? Maybe some kale in a smoothie, sautéed collards, just one small step.
Love that. Small steps add up.
Okay, so we've journeyed through understanding osteoporosis, learning to hear its quiet signs, and exploring these powerful, natural ways to build stronger bones. But the real impact comes from living it, right?
Absolutely. It's about taking this information and weaving it into a future where you feel vibrant and resilient, embracing the joys that come with strong bones as you age.
And it's about more than just bone density scores on a test, isn't it? There's a bigger ripple effect.
Oh, definitely. Think about independence. For many people over 60, the biggest fear is losing that ability to care for themselves. Strong bones mean freedom.
Freedom to do what?
To walk confidently, pursue hobbies, carry your own groceries, pick up your grandkids without that constant worry about falling or breaking something. That freedom is priceless.
Yeah, absolutely. And it fuels an active life, doesn't it?
Completely. With stronger bones, you feel empowered to keep doing the things you love, try new things, travel, stay connected with friends through activities. That morning walk, gardening, maybe even playing a sport you enjoy, strong bones make it possible.
And the mental side, how does bone health impact that?
It's huge. Chronic pain from fractures or even just the fear of falling can lead to isolation, anxiety, depression. When you take steps to nurture your bones, you reduce those risks. It builds confidence, peace of mind. A body that feels capable helps the mind feel stronger too.
That makes so much sense. And posture. We talked about the dowager sump, but
Yes.
maintaining bone health helps you stay more upright.
Yes, especially spinal health. Preserving that height, that upright posture, it doesn't just feel better physically, it projects strength and grace.
And it sets an example, doesn't it, for family?
A powerful legacy. When you prioritize your bone health, you show your kids, your grandkids, that aging doesn't have to mean decline. It can be a journey of ongoing well-being. You inspire them to build healthy habits early on.
It really is a gift that keeps on giving. Do you have any examples, maybe from patients you've worked with?
I do, actually. I often think of a patient, let's call her Mrs. May. She came to me feeling quite defeated. Severe back pain, she'd recently fractured her wrist. Her confidence was really low.
Oh dear. We started small, very practical things, adding specific calcium-rich greens and seeds to her meals, gentle Tai Chi movements she could manage, a personalized herbal tea blend, and slowly, really gradually, things started to shift. Her pain lessened, her posture visibly improved. That constant fear of falling started to fade.
That's wonderful.
The absolute joy on her face when she felt confident enough to walk without her cane again, just to move more freely in her own home and garden. It was incredible. A real testament to the body's ability to heal and strengthen when you give it the right support.
What a great story. Really shows it's possible.
It really is.
So we've covered a lot today. From understanding this silent disease, tuning into its whispers, to embracing these really effective natural ways to strengthen your bones. The key takeaway, your bones are alive, they're dynamic, constantly renewing. And by putting these ideas into practice, that the nutrient-rich food, the right kind of movement, those mindful lifestyle choices, you're not just passively aging. You're actively shaping a future with more independence, more activity, more vibrancy. Beautifully put. But one absolutely crucial note of care.
Yes.
Please, always talk to your doctor before making big changes to your health routine, especially if you have existing conditions, take medications, or have already had fractures.
Right. This isn't about replacing medical care.
Not at all. Your doctor can give you a proper diagnosis and help you figure out how to best integrate these natural approaches alongside your conventional medical care. It's about teamwork, working in harmony for the best, safest outcome for you.
Excellent point. Safety and personalized guidance are key. So, as we wrap up, maybe a final thought for you to ponder.
Okay.
What's one activity, something you miss doing, or maybe something you dream of doing, that having strong, robust bones could help you achieve? Just hold that picture in your mind. What does that vibrant future look like for you?